Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah. Welcome to another class of 360 OET Prep Series. Inshallah, today we will learn about the hidden and the top tips and tricks for the reading subtest of OET. So, let me show you the different tips here, and these are the self-learned techniques. By the way, I am using them for um, a lot of reasons, and now I'm sharing it with you because it helped me a lot and it helped a lot of people. So these are now very well to reveal. So first one is the skip and scan text. Skim and scan text is the first and the foremost one here in the reading section to crack reading section of OET. Uh, the main concept of reading section of OET is not actually the reading of all the stuff and all the text there. It is actually the skimming and scanning of the text, and you just need to scan it like you are just scanning something in front of you. Just look at the words and look at the information in front of you, and then you have to just look the statement, the information you have just scanned. Then pay attention. The second technique is the pay attention to the heading and subheading. Oh god, this one is the life-saving technique. You don't need to go to the text as a whole. First and foremost, just check the heading. What is all this text about? And then go to the all text. And even sometimes you even don't go to the text. You just got the ideas and you got the concept of all the text there. That's all about the two tips. And the next one is the look for the signal words. This is again a very top tip or trick that is very neglected or hidden one. Many readers actually try to read the whole text. However, you don't need to read the whole text. You just look for these words. These are the signal words, or you can say these are the trick words. However, although despite, but nevertheless, in contrast, why these are the signal words? Because it is actually giving the summary or the whole sum of all the text there. So these are the signal words. You just need to hover to them and pick up the concept or pick up the meaning of all the text there. So let us apply these three tips first, or tricks first, and then we will discuss the next one. I have a very genuine paper here that is from OET readings subtest. And as you are well aware about part A, that comes with different text from A to D, and you need to read all the text, and then there are 20 questions approximately from part A. You need to answer them. So let us apply the tips we have just studied now. The first one is when you just look to the text here, read the heading: primary clinical care guidelines, management of head injuries. So this text is all about the management of head injuries, and you need to skim and scam now. First, you have the idea that it is the management points, and there are different methods here or the steps mentioned here that are used for the management of head injuries, like monitoring, observations, notification, preparation, uh, patient warming, like that. And these are all that stuff. Let us see the next one that's actually required from the original OET exam. And this one is again the patient prevention head injury. You just have to look the heading, and there are two again headings here: closed head injury and open head injury. And there is a sheet of the closed head injury management or the prevention of the head injury. And there is also a management step or the prevention step of open head injury. Eventually hover down and see the last one is the arrange MO review next clinic. Here we also have the CT scan is required, or maybe the CT is not available. So what are the other steps? This is skimming and scamming technique. I am just looking the text. I'm not reading the text. I'm just scanning the words and looking what is all about and using the techniques. Then the next text is about the head injury clinical features in child, and there are two indicators here: immediate risk factors, and next one is the high risk factors. So this table is all about the different health indicators that make up the risk factors, and there are two divisions of the risk factors here. And there are different points mentioned here. So let us look to the next text. That is the text D. It is all about the advice for patients who have received an injury to the head. So this is all about do's or don'ts. You can see use, rest, take. These are all about something giving order, do it, and then these are some don'ts here mentioned here. And then there is the management step: return to the clinic, and patient is to return to the clinic. There are two steps mentioned here that are the returning to the clinic points. So this is all about the text. I haven't used all the reading here. I have just scanned the text. I have just skimming the text. I have used the heading technique. I am using what I have got now. So let us see the questions now. The part A comes with the first five questions that are about the paragraph writing or text writing. It is asking about what patient should or should not do when they return home. So this is mentioned in the last paragraph, that are the do's or the don'ts, or you can say should or shouldn't do. And you have also analyzed that there are some points mentioning the return of the patient to the home. So this is all about the text D. Then the possible causes of abnormality apparent in the patient's eye. So this is about the cause. The cause of the disease is absolutely obviously the mentioned in the first one, because the next one is about different other risk factors. So first one is the management of the head injuries, and here we have different causes mentioned here. You can see in this paragraph, if you look deeply. Now this is the area which have been questioned. If one pupil becomes dilated or fixed, this may indicate expanding hemorrhage. Consult MO immediately. So this is about the cause of the eye injury, and obviously it is the initial text that will refer to this type of the question, not the next one. Then the next question comes with a reason why patient should seek medical attention after being discharged. So this is all about the text D, because it has some stuff like return to the clinic immediately if the patient has reported vomiting, like that. This return to the clinic has now been questioned. The next question is about the procedure to follow dependent on type of the head injury, and we have just scanned that there are two type of the management in the flow chart: closed head injury and open head injury, and it has been questioned in our original question. So these are all about the easiest part of the whole OET. Reading is being considered the easiest part. You can make it very easy, you can also make it very difficult. It's up to you. Now use these techniques carefully, and you will just crack it down. You can crack it down like a hell. Past interventions and condition to be considered when assessing the risk, and this is again a very easy question, and it is about the risk factors, and these are the assessments of the risk factors here. And this text C comes here. So let us see about the other tips and techniques we have here. Um, so next one is about the signal words. Obviously, the signal word technique is used in part B and C. more, because there are big paragraphs there, and we need to just look for the signal words, and we need to answer the question, and we need to hover to the information that is actually needed, not need to read the whole stuff there. Then take note of the author's tone. Sometimes this helps a lot, because many a times the question is being asked about why this author, or why this speaker, or why this writer is writing this, what is the purpose of this all text, or what is the purpose of this whole topic. So you have to notice the author's tone. It may be a positive reinforcement, it may be a negative reinforcement, or maybe the it may be an advice, or it may be a warning, it may be an update, it may be a teaching stuff. So you have to note that, and sometimes the original questions come with the author's tone question. Okay, then next one is obviously the not the tricky one. You don't need to spend too much time on one question, like in listening. Listening part of this OET, that is actually a one time question or one period question. If you miss one question, you don't have the second chance. But in our reading section or reading subtest of OET, you don't need to worry about the missing of one question. If you are taking too much time to understand the question, just leave it and then solve it again and come to it again. Okay, because your text is there, your question was there, and you don't need to worry about the missing questions. Okay, then use the context clues. Sometimes there are some words mentioned in the question, or maybe in the text, that you are not well aware of their meaning, and you are not sure about the meaning of the word. You can use the context. You can use the meanings of the other words, or meaning of the other sentence mentioned in front of, or before, or after that word, and you can just crack it. Okay, then read the questions carefully. Obviously, this is not a good like a hidden tip or trick. This is a very well aware tip you are aware of. And the practice. Obviously, you are more prone to this, or inclined to this part of this advice. So let us see how can we apply the other tips or tricks we have just studied. So I have the part B of OET exam, part B, reading section, and there are 6 questions in part B. Each question comes with a different text, and we need to read all the text, and then there is one question that is multiple choice question, and we have to select the best option. So I have a question here. The purpose of the memo about IV solution bag is to remind health practitioners. So this is about the purpose of the memo about IV solution. And here I can apply the one technique that I have just told you, that is the context technique. Sometimes you are not aware of this word memo, so you can just use the context of the sentence, like it is about the purpose of the memo, who is actually talking about some technique about of the solution bank, IV solution bank, to remind healthcare practitioners. So maybe memo is a person from the medical staff, or maybe it is a member of some maybe administration. So you don't need to worry about the exact meaning of this word. You are here with the you can crack it, you can answer the question without knowing the actual meaning of this word. So this is the context technique. Let us apply the other technique we have studied. So this is now a big paragraph here. We can use the signal words first. Skim and scan hold the paragraph. Use the heading technique. Intravenous solution bags, that is the memo to stuff. And there are obviously intravenous solution bag, there are different like things mentioned here. Use the signal words, like if is the signal word here. If it is then reconnected to the IV land, air can potentially enter the patient's vein and cause an air embolism. Then for this reason is a signal word again. partially used IV bag must never be respiked. Then look again. We have this one. In addition to the potential risk of the introducing an air embolism, respiking can result in contamination to the fluid, which may lead to infection and bacteremia. This last sentence is all about the summary of the whole paragraph, and it comes with the signal word as well. Okay, so I have just scanned few sentences from this whole paragraph, and now I am just able to answer the question, like what is the purpose of the memo about IV solution bags. It is the answer, the option C, why they shouldn't be reused. They are, like it is mentioned here, respite is the synonym of reused, and in the last one, in addition to potential risk factors, like it is why it is not be reused, it should not be, they should not be reused, is mentioned in the last paragraph. So I can answer it very easily. Next question, what do we learn about the use of tens machine, and use the heading technique here, update on the tens machine, and then scan all the paragraphs, skim all the paragraph. The association of chartered physiotherapists, blah blah blah, has an expert panel like this, and then use the signal words, like however is the signal word here. However, in the clinic practice, TENS is not the first treatment of choice for women presenting with musculoskeletal pain during pregnancy. And then however is again the signal word here. If pain remains a significant factor, then TENS is preferable to the use of strong medication that could use the placental, that could cross the placental barrier and affect the fetus. Now, okay, and last one is the therefore. Therefore is the again signal word here. Therefore comes with the summary of the whole paragraph. Tense is preferable for the relief of the pain. So I have been well aware that the use of the TENS machine is, let us see the options. Evidence for the AVK case is non-confirmed. No. They are recommended in certain circumstances. Yes, it is the most appropriate here, but I can select it without checking the last option. More research is needed to the possible side effects is the not the right option here. So these are the this is the second question. The last one comes with the if surgical instruments have been used on patients suspected of having prion disease, they. So this is again a big paragraph here. Guidelines, invasive clinical procedures in patients with suspected prion disease, and this is the heading technique. And this is all about the skimming and scanning. There is one paragraph here, and now let us use the signal word technique. So here we have, for this reason is the signal word. It may be necessary to destroy the instruments after use on such a patient, or to quarantine the instrument until the diagnosis is either confirmed or an alternative diagnosis is established. In any case, the instrument can be used for the same patient on another occasion if necessary. In any case is also a signal word. So I have just used the signal word technique, and let me see the if I can answer the question or not. So the options are they must be routinely destroyed as they cannot be reused. Oh yes, there it can be the option. Let us check the next one. May be used on other patient provided the conditions and be ruled out. It is not be used on the other patients in any condition, because it is potentially, like it is mentioned here, prions. It is necessary to destroy the instruments after use. So after use on such a patient, so destruction of the instruments indicate that it cannot be used in other patients. But we can study more if we are not sure about the option here. Should be decontaminate in particular way before use with other patient. No, because it cannot be used. So option A is the best one here, but option B can also be um, like the correct one. So let us see the other techniques we can use here. Prions, if it is essential that patient suspected of suffering from prion disease affected prior to the to any surgical procedure. Failure to do so may result in exposure of individuals on whom surgical instruments subsequently used prions are inherently resistant to commonly used disinfectant method. So we have this line that can rule out the second option, like it cannot be used in any other patient in any other condition, because there are inherently resistant to commonly used disinfectant and methods of sterilization. So that's all about today's important tips and tricks. And obviously there is a big announcement here, as many of you are well aware that 360 has already started his OET Prep Series, and many students have already joined it, and the first batch has been already started. You can use our free stuff. You can also take our paid videos as well. There are a lot of helping stuff here. I prefer you to check the link below. Uh, there is a good description in you can check in the guru videos description. So take care. We will see you in the next video. Assalamu alaikum warahmatullahi wabarakatuh.